When a man reaches the age of 60, many of his body's functions begin to change. But there is one that, although it remains active, often goes unnoticed, until it starts sending signals. I'm talking about the prostate. This small and seemingly silent organ actually has a direct connection to your pleasure, your hormones, your fertility, and even your mood. And I want to ask you a very direct question. Have you ever truly stopped to think about what happens to your prostate every time you masturbate? Because what you're about to discover isn't something you'll hear in a typical doctor's office or easily find on the internet. Today we'll talk with respect, with depth, but also with the honesty that mature men need. What really happens inside you when you touch yourself frequently? And what risks are you exposing yourself to if you do it the wrong way, or too often? Stay with me because I'm going to show you what science has uncovered about male masturbation and its direct impact on the prostate. And I'll tell you this not only as a doctor, as a sexual therapist, but also as someone who has been supporting men for years. Men seeking answers, relief, and health. The first thing you need to know is this. Masturbation directly stimulates the prostate ducts. Every time you ejaculate, the prostate contracts forcefully to expel semen. These repeated contractions work like a kind of internal workout. And here's the first benefit. It helps clear inflammatory residues that can accumulate in the gland. That's why men who masturbate 4 to 7 times a week have, according to Harvard University studies, a 20% to 30% lower risk of developing prostate cancer as they age. But there's more. During masturbation, your body releases endorphins, dopamine, serotonin, and oxytocin, substances that not only bring pleasure but also modulate the immune system, regulate sleep, and lower cortisol levels, the stress hormone. This indirectly affects the prostate, since chronic stress is one of the main factors behind prostate inflammation. Blood flow in the pelvic region is also stimulated, which delivers oxygen and nutrients to the tissue surrounding the prostate. In other words, when you masturbate in moderation, you're promoting overall better prostate health. Many urologists also agree that men who remain sexually active, or continue masturbating, even into later life, help keep their prostate functioning longer. But not everything is positive. I also want to warn you about real risks. Because when masturbation becomes compulsive, rushed, or aggressive, it can negatively impact both your prostate and your intimate health. The first problem is gland exhaustion. If you ejaculate multiple times a day, every day, your prostate doesn't have enough time to recover. Over time, this can lead to chronic inflammation, prostate congestion, a sense of heaviness in the pelvis, painful urination, and even erectile dysfunction. The second problem is emotional disconnection. Many mature men use masturbation as a quick escape, without presence, without body awareness, and without emotional connection. This can not only lead to isolation, but it also prevents the prostate from functioning harmoniously with the rest of the reproductive system. Third, excessive consumption of pornography or very aggressive techniques can significantly alter the physiology of the male pelvic floor. Even if it seems harmless, or even stimulating at first, over time these practices lead to overstimulation of the perineal nerves and weaken the tone of the pubococcygeus, bulbocavernosus, and levator ani muscles, all essential for supporting the prostate and controlling ejaculation. This results in a kind of neuromuscular fatigue, which manifests in subtle but progressive symptoms: reduced penile sensitivity, less intense orgasms, difficulty fully emptying the bladder, or even the need to strain when urinating. Furthermore, pleasure becomes conditioned to very specific stimuli, such as certain videos or repetitive pornographic sequences, causing the brain to become less responsive to real bodily signals or the presence of a partner. The subtlety, the warmth of real touch, slow rhythms, and emotional connection, all of this begins to fade, even though it is essential for mature and fulfilling sexuality. Fourth, if every masturbation session becomes a race to quick ejaculation, with no pause and no awareness, you are training your body in the opposite direction of sexual vitality. Ejaculation should not be an automatic reflex, but rather the controlled climax of a deep physical experience. If you always ejaculate in less than 2 minutes, your body loses the ability to sustain arousal, to modulate the response of the bulbospongiosus muscle, and to generate the rhythmic contractions that benefit prostate health. This is where valuable techniques like start and stop or edging come in. Start and stop means stopping stimulation just before the point of no return, taking a deep breath, relaxing the body, and then continuing. This cycle can be repeated several times before actually ejaculating. What does this bring? First, the prostate is not overburdened. Second, the body produces higher quality semen, with more volume, higher concentration, and better viscosity. Third, the penis develops a greater capacity to stay erect for longer. And fourth, you regain control over your arousal and ejaculation, which strengthens your self-esteem, your confidence, and your emotional connection with your partner. Fifth, ignoring your body's warning signs after masturbation can be one of the most common causes of worsening prostate problems. Mild pain in the area between the testicles and anus, burning during urination, a feeling of incomplete emptying, or the urge to return to the bathroom shortly after ejaculation. These should not be considered normal. These are alarm signals. Even though it is often just a mild prostatitis or a temporary inflammation, they may be early signs of benign prostatic hyperplasia. In such cases, it is not necessary to stop masturbating entirely. On the contrary, gentle, slow masturbation without forced ejaculation can help drain accumulated secretions and relieve pressure in the prostate ducts. What matters most is adjusting the frequency, optimizing technique, integrating deep abdominal breathing, and if possible, applying local heat to the perineal region to improve circulation and relax the muscles. And of course, all of this should be monitored by a doctor or urologist if the symptoms persist. What I want you to understand today, sincerely and based on the most up-to-date medical evidence, is this: masturbation itself is not the problem. The real issue lies in how you practice it. If it's rushed, accompanied by guilt, repetitive and mechanical, if you ignore your body, without pause, without awareness, it can become a trigger for chronic inflammation, emotional isolation, and prostate exhaustion. Your prostate is not a machine. It's a complex gland interwoven with a delicate network of vessels and nerves, highly sensitive to stress, sleep, diet, and also to the kind of pleasure you experience. Masturbation can be an act of self-care, a way to keep your sexual system activated, lubricated, oxygenated, and hormonally balanced. Or it can become a silent impulse that causes tension, glandular fatigue, and even emotional resistance to your own body. The choice is entirely yours. Yours alone. If you're over 50 and have ever wondered whether what you do in private is good or bad for your prostate, now you have the tools. Pay close attention to your body. Masturbate with respect. Adjust the frequency according to your energy. Breathe deeply before, during, and after. And if something bothers you, don't ignore it. Get it checked. And if this conversation touched you, gave you clarity, or supported you in any way, subscribe to the channel Wise Sexuality. Here we speak without taboo, with science and humanity, about what truly matters. And if you know someone who needs to hear this, share it. Because your prostate speaks. We just need to learn how to listen.